What can you do if the disc recurs? If recurred disc is pulled out with a non-surgical procedure called endoscopy instead of surgery, it does not usually recur. Cedars-Sinai Hospital in the U.S. is a very larger hospital. A nurse who works at Cedars-Sinai Hospital. Even though he underwent surgery at the hospital, his legs continue to hurt and shouldn't sleep for about 2 weeks. And I pulled out the recurred disc yesterday with endoscope. Symptoms had been bothering him for 2 years were completely improved by taking out a small piece of recurred disc. Soon after, he will return to the United States. He is going back to the U.S. in 15 days. As it was not a major surgery, he was discharged from the hospital in a day. Second, if the nerve becomes edema due to inflammation, it usually gets better with medication. However, if there is no improvement with medication, you can proceed with injection treatment in the area with nerve edema. Through CT image-guided injection precisely at the site of nerve edema can improve the condition. The third reason is that although the patient underwent disc surgery, the actual underlying issue was stenosis, which means that the ligaments should be thin like paper, have become significantly thicker. Despite the successful disc surgery, some patients continue to experience discomfort due to spinal stenosis caused by thickened ligaments or joints. In this case, reoperation is required to remove the bad ligament, but this is very difficult and dangerous. Reoperation on a previously treated disc is very likely to fail. A special system and equipment should be equipped, and a high-speed drill and navigation are required. A super-speed diamond drill allows to grind only the bones in the problematic area. Without touching the normal tissue, surgeon can safely treat the area with it. If it is disc level at L4 and L5, going up from L5. If it is disc level at L5 and S1, when going up from S1, it follows the nerve trunk all the way like this. So reoperation can be safely done. There is the fourth reason. The disc surgery went well, but the disc is hiding in the wrong place. What it means is that there is a 90% chance that the disc has herniated centrally and is in the spinal canal. However, in 10% cases, if there is a disc outside the neural canal, disc is ruptured and hidden again. It may not be visible on MRI or CT scans. Even if the original disc was treated well, it hurts when there is a herniation outside the neural canal. When the nerve is still compressed, it can be treated well with the endoscope because no bone outside the nerve hole and the spinal bone is outside. Additional treatment makes it better. After a disc surgery, you should not feel any pain at all. If your leg hurts, something is wrong. Your legs shouldn't hurt. The benefit of disc surgery is that it can completely alleviate the symptoms. The person who undergoes surgery will recover without leg pain, while the person who doesn't undergo surgery will suffer from leg pain for about 10 years before recovering. This is clearly stated in the paper that receiving a proper disc surgery can lead to complete recovery without leg pain. You can find the answer among the 4 reasons I mentioned. It should be thoroughly examined and properly treated.